Taking GLP-1 medications like Ozempic or Wegovy, or maybe you're thinking of starting. With insurance companies making it harder to get these drugs covered, knowing how to secure and maintain access is critical. Stick with me and I'll share 5 concrete steps to navigate insurance, maximize results, and set yourself up for long-term success. Here's why I'm the person to guide you through this. I spent decades in medtech and biopharmaceutical companies specializing in insurance and access, evidence generation, and getting life-changing drugs approved and reimbursed around the world. I know how to navigate the red tape and advocate for patients and generate data needed to secure coverage. But this is also personal to me. At the age of 52, I faced a mental and physical health crisis. I was 120 pounds more than I weigh right now, insulin resistant, and at rock bottom. Through hard work and complete lifestyle overhaul, I turned it around without GLP-1s. My journey inspired me to create the Heavyweight Community, where we tackle health challenges together, whether you're on a GLP-1 or not. We're here to help you succeed. Here's what's happening. Major insurers are scaling back coverage of GLP-1s. Blue Cross Blue Shield of Michigan cutting coverage for weight loss specific coverage. Ascension in 2023 ceased coverage of weight loss and anti-obesity drugs for approximately 140,000 employees. Kaiser Permanente removed access for patients with a BMI under 40. And the Mayo Clinic imposed a lifetime limit of $20,000 for weight loss medication coverage. These changes are happening as evidence that GLP-1s need to be taken for a lifetime to maintain their benefits. Stopping the medication often leads to weight regain and worsened health outcomes. That's why it's critical to secure and maintain coverage, and I'll show you how. Here are the 5 crucial steps you need to take. Check your plan's coverage. Start by reviewing your insurance plan's formulary, the list of covered drugs. Look for GLP-1s under conditions like diabetes or obesity. If you're unsure, call your insurer and ask them these specific questions. Is the medication covered for my conditions? What are the prior authorizations required? What is the copay or co-insurance for this medication? Does it count towards my deductible? And if so, how much will I need to pay out of pocket before coverage kicks in? Are there any coverage limits such as maximum duration, specific conditions I need to meet? Understanding these details up front helps you avoid surprises at the pharmacy and ensure you can plan for any out-of-pocket costs. Gather the necessary documents to back your case. Gather diagnosis records, for example, for diabetes, your BMI, or other health condition. Progress reports from your doctor showing how GLP-1s have helped. Evidence of previous authorizations or prescriptions. Having this paperwork ready ensures you're prepared if you need to appeal a denial or meet strict requirements for prior authorization. Pharmaceutical companies like Novo Nordisk and Eli Lilly offer patient assistance programs. Visit their website and apply if you're eligible. These programs can reduce your out-of-pocket costs, especially if you're facing high deductibles, copays, or co-insurance expenses. If your coverage is denied, don't give up. Work with your doctor to file an appeal. Include why the medication is medically necessary, risk of stopping treatment, evidence of how it's improved your health. Many appeals are approved when you provide thorough documentation and persistence. Don't be afraid to ask your insurer's appeals department for guidance. They're required to provide details on how to submit your case. Build a long-term strategy of support. Here's the key. GLP-1s aren't a short-term fix. They're a lifelong tool for managing health. Your strategy must include regularly review your insurance options to ensure GLP-1s remain covered. Use open enrollment periods to explore better plans if your current one has a high deductible or unfavorable coverage terms. Focus on eating protein-rich meals, lifting weight and limiting refined carbs and sugar. Strength train regularly to ensure you're not losing muscle but fat. This journey is easier with others. That's why I created the Heavyweight Community, where we share tips, resources, and motivation to help you succeed. Subscribe and hit alerts, and be prepared for weekly tips and insights for building sustainable habits. GLP-1s are a tool, but your long-term success depends on how you use them and what you build alongside them. When I first started losing weight, I made a big mistake. I focused only on the scale. I lost weight, but it wasn't until Later, when I started using her Smart Scale, I realized I was losing muscle. Muscle is not only key to your metabolism, but for your overall health and longevity. Muscle is more than just strength. It's a critical factor in long-term health. As Dr. Peter Attia, a leading expert in health and longevity, says, muscle is the organ of longevity. It's not about looking fit. It's about maintaining metabolic health and reducing the risk of chronic disease and staying resilient as you age. That's why strength training and eating enough protein are non-negotiable. Muscle keeps your metabolism strong, supports overall health, and helps you maintain your progress. Focus on fat loss, not just the number on the scale, and prioritize building and preserving muscle as part of your health journey.